Hi everybody, Richard Nijelski here for FitLink. In this video, we'll be discussing a client health assessment. A client health assessment provides an opportunity to assess the client's general health, their needs and goals, and design a training program to suit. It also provides the chance to begin building the relationship and trust between you and the client. Where possible, it's best to conduct the screening in an environment which is comfortable and quiet. The client may have already completed a pre-screening questionnaire during the fitness orientation. If not, give the client a few minutes to answer the questionnaire and then go through the information together. The health assessment is a good time to gather other health-related information and discuss with the client any pre-existing medical conditions, current level of fitness, training history, and any other expectations or worries they may have. At FitLink, we recommend the Adult Pre-Screening Tool. A copy can be downloaded from the Fitness Australia link provided at the end of this video. From the information gathered, a client's current health status can be classified as one of 3 levels through a risk stratification process. Low risk is when a person has no signs, symptoms, or diagnosis of cardiovascular, pulmonary, or metabolic disease, and no more than one cardiovascular risk factor present. A person at this level may participate in aerobic physical activity or exercise up to a vigorous or high intensity level. A person is considered at moderate risk where there are 2 or more cardiovascular disease risks, but no signs, symptoms, or diagnosis of cardiovascular, pulmonary, or metabolic diseases. A person at this level may participate in aerobic physical activity or exercise at a light or moderate intensity level. High-risk classification is when there are 1 or more signs or symptoms of cardiovascular, pulmonary, or metabolic diseases present, or a positive diagnosis of cardiovascular disease has been confirmed. When a person has level 3 risk factors, it is critical they see their GP, or you, the trainer, refer them to one. There may be more health issues than you, as a fitness professional, is qualified to deal with. Having the client obtain a clearance from their GP or a relevant health professional will give you and the client peace of mind and avoid any complications later on. Now let's look at an example of a client health assessment where the risk stratification process is utilised.
Hey Kestra, thank you for coming in today. Obviously I saw you when we did your pre-screening test when you first came in and signed up. Today's part 2, we're going to do health screening, the rest of it. We're going to take you through a few more questions and then I want to do some health tests on you as well. Is that alright?
Great, yeah.
Brilliant. Let's get started. So, your name and details there. A few more questions. How old are you?
I'm 29.
29, cool. Female, obviously. Have you had any family history of heart disease or anything?
Yes, my dad had a heart attack when he was 45.
45. I'm sorry to hear that. What about smoking? Are you a smoker at all?
No.
No smoking, that's brilliant to hear. What about high blood pressure? Has anyone ever told you you've had high blood pressure?
No, not high blood pressure.
No, excellent. Have you ever been told that you have high cholesterol?
Yes, I was told that a few years ago.
Where did you have this taken, or?
Just at the pharmacy.
At the pharmacy, yeah. Well, that's something we'll have a look into a little bit later on down the track. I don't think it's anything to worry about too much at this stage. Have you ever been told that you've had high blood sugar?
No.
No. Excellent. Have you spent any time in the hospital in the last 12 months? Any injuries, any issues?
No.
Anything at all? No, that's good. Currently taking any prescribed medications?
No.
No, excellent. And you're not pregnant or given birth in the last 12 months?
No.
I guess you're nice and healthy, which is good. What about any injuries or any soreness or anything you've had? Anything I need to know about?
Yeah, I rolled my ankle about 6 months ago playing football.
Rolled your ankle. Was it quite a serious roll? Did it put you out for a bit?
Yeah, I had to stop playing, so I haven't done much for the past 6 months.
That's cool. How's it feeling now when you put pressure on it?
It feels okay, I don't notice it.
Cool. Was it your left ankle or your right ankle?
It was my right one.
Right ankle. All right. We'll just write this down as well. Just in case anything pops up later on. We've always got it on file. Have a look at that. Right, in terms of your exercise that you've been doing lately, do you do any exercise currently? Do you do any training sports or anything?
Yeah, I have football training once a week and I play a game once a week.
Football training once a week? Cool. How long does that training last for?
About an hour and a half each.
Hour and a half? So looking about 3 hours or so of physical activity a week?
Yeah.
Yeah, cool. And let's talk about intensity. Are they quite intense sessions? Are they moderate socially?
I'd say moderate to high level.
Moderate to high level? Cool. So you've obviously done a little bit of moderate, vigorous intensity before. So that might be something we look at later on in terms of the workouts that you're doing. And what's sort of the reason for coming to the gym?
I
obviously-
just need to get stronger and
Yeah.
better for football.
Was this in relation to the sport you're playing at the moment?
Yeah.
Brilliant, cool. I'm sure we can work a few things in with that. We're now going to go through a few health tests. All right, so the first one's going to be a BMI. So this is a quick and easy test that measures your body composition. Going to give us an underweight, normal range, overweight range. Nice and easy to use. We're just going to take your height and then compare it to your weight.
Okay.
So it's going to give you what sort of weight range you should be in comparison to your height. Sound cool?
Sounds cool.
How tall are you at the moment?
I'm 158 centimetres.
58 centimetres. And what I'll do is we'll take your weight. If I get you to just take your shoes off and stand up for me. Just have a stand on the scales for me. That's perfect. Just sit down for me. So we've got your height, we've got your weight. Just put those two numbers into our calculation. Comes out at 23, which puts you in a nice, normal, healthy weight range.
Great.
Sound cool? Next test that we're going to perform is a blood pressure test. Have you had your blood pressure taken before?
I have.
You have? Do you remember what the score was?
No, I don't.
No worries. So we're going to put the cuff on here. We're going to have the cord facing down through the middle of your elbow here, just where the brachial artery is. We're going to wrap the cuff around. Have you had any coffee or anything today?
This morning I did.
This morning?
Yeah.
Shouldn't be too bad. What about any physical activity, anything
No,
today?
not today.
Excellent. So this is going to inflate. You're going to feel a little tightness on your arm. At the end of that, it only lasts a few seconds, so they're going to drop down for you.
Okay.
Sound cool? Brilliant. And we have 105 over 58. So that's in the lower part of the normal range. Sorry about that, Kestra. Nothing we need to worry about there. We'll monitor that down though, and when we next do the test, we just compare the answers, check we're all going along nicely.
Great.
Cool. The final test we're going to do, Kestra, is your waist-hip ratio. Right, so this is going to tell us if there's any underlying issues in terms of your health at the moment. Right, so we're going to take the circumference of your waist and also the circumference of your hips, and then we're going to compare the two. Right. So if I can just get you to stand up for me. What I'll get you to do is just put your feet both close together. Cool. If you can have your hands up, hands on your shoulders, perfect. What I'm going to do is just pass the tape measure around you. I'm going to take the waist one first. It's going to be the circumference of your waist. Just going to find the smallest area. As you see, waist. Perfect. So record that one down. The next one we're going to do is the circumference of the hips. So this is going to be from the largest part around your hips, all right? So again, I'm just going to pass it around. Just check that that's level. Cool, I'm going to put that one down as well. Just take a seat for me again, Kesra. What I want to do is put those two numbers into our calculation, into our formula. Cool, and we come out at 0.76, which again puts you in a nice normal range. It's fantastic, just where we want to be. Gone through a few extra questions. We've found that you're in a relatively healthy stage. You're actually in a moderate risk factor, but you're at a very low moderate risk factor, and that's because of obviously the heart attack that your father had a while back, and also the high cholesterol that you had at the pharmacy at that time. That's something that we might need to get checked a little bit later on.
Great.
What we will do at this stage is obviously start you at moderate intensity, just to make sure everything's going all right for the first few weeks, for the first month, and then if that all looks good and all the tests come up all right after that, we'll move you on into some slightly more intense workouts.
Sounds good.
Sounds all right? Thank you, Kestra.
Thanks, Matt.
So that was an example of a health assessment. Had the client been classified in the high-risk category, then a medical clearance would have been necessary. If the client has a regular GP, get them to make an appointment. Alternatively, you may need to recommend the client to an appropriate medical or allied health professional yourself. There are several ways you can do this, including email, a personal phone call, or even an old-fashioned letter. Whichever way you decide to refer the client, remember to include your company or business letterhead, the medical practitioner or allied health professional's contact details, the client's name, address, gender and date of birth, and a detailed reason for the referral or medical clearance. As you can see, a health assessment gives you a great opportunity to find out more about the client and the goals, develop rapport, and build that client-trainer relationship. It's important to make the client feel comfortable. Remember, you may have done dozens of health assessments, but for your client, it may be their first time. Keep the mood light and informative. The more information you can give to the client as to why the health assessment will help them, the more information you can expect back, and that means a better end product. So it's a win-win. It may be likely that you will uncover a potential health issue or touch on a subject that may be sensitive to your client. Always be mindful and respectful when discussing health issues. The next step is to perform a fitness assessment with the client. That's where the client is taken through a series of tests to measure strength, flexibility, and cardiovascular performance. Just which tests you decide to use will depend on what the client's goals are, what tests you regularly do, and what the facility recommends or requires.